Hey, in this video, let's talk about the hip joint and let's bring you a tour around your hip. Hi, welcome back. This is Aubun Wei, your exercise physiologist, helping you better understand your body and improve your health, fitness, and performance. So in this video, we want to talk a little bit about the hip joint. In fact, not a little bit, but quite in depth. So once you understand the anatomy, you understand what's around the hip, what can cause you possibly some pain or problems around the hip. So let's not waste time, let's dive right in.
Alright, so let's begin over here. So we have mainly the bones, and looking at the hip area, I would say a couple of bones, multiple bones, we're talking about over here. Mainly your pelvic bone. This is actually, you want to think of it like a bowl shape, okay? And in between the bowl, it's where your tailbone is, which is your sacrum, and then you have something in between, just fusing them together, okay? And then this, I'm trying not to touch too much on your vertebrae and your lower lumbar, your lower back, but we will have to talk about it a little bit, and you'll understand why later on, okay? So, and then we have your femur bone, and this is the one that we commonly known it as the thigh bone. Right, so these are the bone structures. Before I continue, the pelvic bone, basically, it is actually split into three portions. This is where you get your tailbone, and then you actually realize that it's split according to the colors. So the red one, we call it the ilium. The green one, we call it the ischium, and the yellow area, we call it the pubis. Again, you will understand why later on, why I'm talking about all this. Okay, I'll bring this picture back as well. So, around the bone, very common problem that we hear and people talk about is this layer. Let me zoom in a little bit. This thing that it's in between your femur bone and your pelvis, it's actually what we call the labrum. And if you have heard about a labrum tear, some tears inside the hip, this is where the labrum is. It basically sits in between this bone and this bone, okay? And this, I would easily equivalent it to your meniscus, because the function is very similar. It is there to provide you that smooth gliding kind of effect around this bone. That's it. Okay, so that's where the labrum is. Bringing in you more ligaments over here. Let me stop here. Okay, so not much from the front. There's actually one piece that's just over here, and it runs from the top part of your pelvic bone to the, this is really very close to the groin area, okay? I don't exactly know what this ligament provide. There's always a reason why this is here. I haven't heard heard anyone talk about this, okay? There's definitely a function over there, but just remember there is a ligament running over here, all right? So coming from the back, we have this ligament. Let me zoom out a little bit. We have this ligament that is called your ischiofemoral ligament. Okay, notice the name. Names on your body are basically named after certain parts. Has some names. So earlier on, we talked about the ischium, this green color portion. Basically, how you get the name as, I can't do this, okay. You have your ischia, which is this part. You have your femoral bone, your femur, and that's how this name is being formed. And later on, you will hear a lot of this combination of part of the bone with another part of the bone ligament. Okay, and hence this picture over here. This is really just to show you why such a funny name that they gave, but that's because this bone itself already has 3 names to it. Okay, so, and this is your ischiofemoral ligament. Okay, and then we have your sacrum to your tailbone. Okay, so again, you get this kind of names. These are all your ligament tissues. They're just connecting everything together. Right, let me bring in more things over here. Right, then you start to have something that looks like a capsule. Okay, this are again your ligaments that's just holding bones to bones together. Okay, and this looks really like a capsule around your knee joint that's just basically wrapping everything together. Okay, so this is what it is. And then we have more ligaments, right? So these are the ligaments that's basically there to hold everything together, and they kind of behave like one piece, yet allows it to move around a little bit without without too much of a range of a motion. Okay, so then over here you have your iliofemoral ligament, you have your pubofemoral ligament, you have your oh, we went through this. Yeah, and basically all these kind of ligaments are just tissues that's there to make sure that everything is just intact and together. That's my point. Okay, so let's talk about something else that is usually causing hip joint related pain. Okay, having said that, these are the structures, and all of them are actually a possibility of the pain around this area. Okay, so what you see over here is really what you get, right? So let's start bringing in some muscles here. So the very first layer, or rather the very deep inside layer over here that we see, let's start everything from the front so that you can actually have a better idea of where the muscle runs and where it ends. And also later on, you realize that some muscles, the way they run, they crisscross, and you don't even know whether it's coming from the back or from the front, but basically that's how the muscle runs. Okay, so over here, what a lot of people like to talk about is the group of hip flexor muscles, which will include your psoas major. Okay, so this, you can actually see that the muscles are actually coming from your spine and run all the way down to the front of your thigh bone, your hip. Okay, so the front of the thigh bone, and then it actually inserts into your thigh bone. Did I say hip? Again, runs from the front of the hip bone and to your thigh bone. Okay, right. So then you have your psoas minor. Okay, so this guy not many people talk about because nobody cares about this guy. This guy is just too small to be talked about. Again, there's a function for this muscle as well, and you can see that although it is very near to where most of the muscles are origin, it inserts into another place in your pelvic, okay, or your pelvis area, pubic area, right? And then we have another guy that is called the iliacus. This guy is basically inside the hip. Okay, so from the front view, this is what it looks like. From the side view, you can actually see that it actually sits nicely inside the hip. Okay, and these 3 mainly form your hip flexor group muscle. Having said that, there are actually muscles that is around the hip that is considered part of the hip flexor group just because they are so near and they sometimes take over certain muscles group. But in general, these 3 are the ones. Okay, so don't get yourself confused when you hear some other people talking about hip flexor group and then they start linking it you to other muscles. These 3 are the main ones. Okay, so going down, we have your adductor muscle. Okay, these muscles are basically the one that runs really inside the groin and to the side of your thigh bone. Okay, they're usually not let me take back my words. They're actually quite strong muscles, but the function of it is very limited because of how it's being attached, and it's usually coming in more like a supporting muscle. It supports this area more than anything. The movements, very little. Okay, as in you wouldn't find yourself moving in that particular action, that particular movement, unless you are a soccer player, which most people would understand. When you pass a ball, this is the muscle that you will use. Okay, so, and that's why the name. Okay, it is in the adduction movement, and hence you get your adductors. Whichever comes first, movement or the muscle, I don't know which one comes first. Okay, so these are actually two muscles over here. There's actually one that's not coming up yet. It will come up soon, right? So there's basically three of them. There's your magnus, there's your brevis, the longest, here we are. Okay, these three basically are the main guys over here, right? That's considered your adductor group muscle. Okay, the one that is coming in over here right now, I would say it's like the cousin. It's very, very close. The functions are very similar. Okay, and this is your pectineus, right? So let me zoom out a little bit. And when we talk about the pelvis, we talk about the pelvic area, you realize the group of muscles that we call core muscles are coming in. Okay, so you have your transverse abdominal. Okay, let me bring more in. You realize that there are actually many layers, right? So this is like the first layer, and then you have more layers coming in. Okay, so internal oblique, and then of course you have your external oblique here. Okay, so there are actually many layers of muscle that forms your core, and your core muscles basically all runs down and attach to your pelvic area. Okay, and hence I say we cannot not talk about these muscles because they play a part when we talk about your hip. Okay, so these are your core muscles, right? And then of course what everybody likes, right? Your pecs. Okay, so let me just rewind a little bit. This is just to show your core, because there are many things that's coming from the bottom that we kind of missed. So we were here, and I was just showing you the core muscles. We're not going to talk about it later on. Okay, so let's focus a little bit more nearer to the hip. Over here, you have the next thing coming in, according to the software, your quadriceps muscle. Okay, so you notice that a lot of them are actually coming from this part of the thigh bone. Okay, the three of them. The very last one actually goes all the way up here. This, mind you, it is still your quadriceps muscle. The reason why it's called your quadriceps is because there are four of them over here. Okay, so you see that it's actually coming all the way from this part of your pelvis. Okay, and that's how high this guy actually runs. Okay, so these are your quadriceps muscle, and you realize there's something that not many people talk about it, but people do get it straight and can't figure out what this muscle is until they know this muscle and know how to stretch this guy out. This is your sartorius muscle. It runs from the hip, kind of like the front of the hip, to the side of the knee. Okay, so when we talk about hip problem, we also want to look at the knee joint sometimes, especially when we're talking about the musculoskeletal system, because we know that there are muscles that's running up from the hip to the knee. Okay, so one more important muscle, and from the front, we usually call this the TFL, the tensor facial artery. Again, this software likes to group this muscle together. Most people just talk about the TFL and leave the TFL aside. Most people talk about the ITB, which is your IT band, your iliotibial band, and leaves the TFL aside. And in my opinion, you can't, which is what the software is doing, because if we talk about just the TFL ends nowhere. and we bring in the band. Basically, these bands are like the tendon that is attached or trying to attach your hip bone and all the way to the side of your knee. Okay, so this is your TFL. Okay, so this is how it actually looks like over here. And this is, I would say this is kind of like the muscle that is supposed to belong to the front but sits more on the side. Okay, so these are the muscles from the front. Let's move to the back. Okay, and again, let's start here. Now, first layer, and you will realize that there are actually some muscles that are actually running up. Okay, so let's get this over and done with. There are actually, I will group them and call it your erector spinae muscle. And these are the ones that's basically running from your neck, as high as your neck, okay, and all the way down to your tailbone. Okay, so they are actually running down in this manner, and it all sits around here. Okay, so remember this, there are actually muscles that's connecting you from somewhere else to this certain area of the body. This particular video, we're talking about the pelvis. Okay, so let's bring you back here. Okay, many people will talk about the QL muscles, the quadratus lumborum. This guy plays a very small part of, when you think about contraction, it is basically trying to crunch your, it plays a small part, I say it again, crunch your ribcage towards your pelvis. Okay, so in general, whenever you see a muscle running in a certain manner, think about it as a band that is attached over here and attached over here. What they're trying to do when they shorten, and that's what the muscle does when they contracts, and that's how we move. They are shortening each other together, and that's how it creates movement. Okay, I'm not gonna go too deep and too much into it. This is supposed to be a tour around your hip. Okay, so let's come in a little bit. This is your adductor, we went through it. So these are the muscles that's more on the side, not consider the front or the back. Okay, and then over here we have your quadratus femoris, and this guy is a very small guy that is just from part of your pelvis to the thigh bone. Okay, so you will notice that, and I usually like to call this group of muscle the rotator cuff muscles around the hip. They will come in very soon, just bear with it. Okay, they are very similar. If you think about us as any other four-legged animals, this basically resembles a lot of this. Again, I'm not going to talk too much about this, but just to show you, most four-legged animals, they have something similar, whether it's the front leg or the back leg. Okay, so back to the hip. And these muscles, when we talk about rotator cuff, they're actually helping you with the rotation of your thigh bone. Okay, and think about it, when it's contracting, it is just turning your leg externally. Okay, so these are the muscles. I mean, this is the muscle, all right? So let's give you a bit more muscles, so let's not bore you too much over here. And then coming in are your rotator cuff muscles around the hip. Let's stop here for a while. So at the back of the hip, you have all these muscles. I usually call this, or call them, the piriformis group muscle. This is my personal preference because the functions of them and the piriformis won't go too far. And they are called the rotator cuff muscles of the hip. And you realize that these muscles, they're just so close to each other, and most of them are just trying to help you with the rotating of your hip or your thigh bone or your legs externally. Okay, similar to your rotator cuff, the real rotator cuff that we're talking about here, or most people talk about on the shoulder, and you look at the muscles over here, yeah, they are actually helping you with the rotation around this bone over here, which is your humerus. Okay, so you will see very similar functions of muscle around your body when you understand how we function. Okay, so coming back a little bit, and this is your piriformis muscle. Okay, like I said, I usually like to group them together. and it makes my job a lot easier. Right? So here we start to see the little brother. Okay, this is your gluteus minimus. It is considered also part of your hip muscle because it is coming from this part of your pelvic bone to the side, or rather the front of the hip. Okay, so this is basically your gluteus minimus. Coming in, so this is your little brother. Coming in, we have the second brother. This is your gluteus medius. Similar origin as the little brother, but this time round you realize that it's on the side. Okay, it's really on the side, right? So this is your second brother. And then we have your big brother, this guy. Okay, this muscle is what we usually call the glutes. Nobody cares about the little and the second brother. If we really talk about the glutes, let's not forget that the glute muscle has a big brother, a second brother, and sorry, we can't see the small brother, and that's how small and how behind this guy is. Okay, so how deep this muscle is. So basically you have the small brother, okay, small brother, second brother, big brother, small brother, second brother, big brother. Okay, I hope this gets into your head. You have 3 muscles for the glutes. And I usually like to call this the cousin. This group of muscle, the piriformis, like I mentioned earlier on, I usually like to call them the cousins because most of the time, when the big brother doesn't work, the second and the small brother has to work. Okay, and sometimes these guys are working together with the cousin because the big brother just fails to do the work, and this can cause you hip problem. Okay, so these are the ones closest to your pelvic area. One last group of muscle that we often neglect that can cause hip problem. Let's start here. This is part of your hamstring muscles. Okay, so again, hamstring muscles has got 4 of them. Usually people only talk about 3 of them because they are very closely around the same origin and goes down to your knee. The other guy that is part of your hamstring group muscle is this guy. We're not going to talk about it. We talk about it in your knee, in the knee tour. If you're not sure, please go and see the knee muscles again. All right. So just going to talk about this quickly. Hip muscles, hamstring muscles, they all origin over here, just before the big brother come in. Okay, so your hamstring group muscles, they are all originating from this part of your hip bone. Okay, this is how close they are, and this is where they origin. Okay, so I hope you have a better understanding around the hip area, whether it's from the back, from the side, from the front, from the inside, from the outside. These are the structures that, as I would say most people would have been born with all these structures. Okay, so a lot of us, we need to understand the anatomy, the structures first, because they all can lead to hip related issue.
Alright, there you have a hip tour so that you can better understand the structures around the hip. Let me try and talk a little bit more about the muscles and muscles around the hip in coming videos. So if you have any questions, don't forget to drop by the comment section below. And if you like my videos, please don't forget to subscribe. Don't forget to click on the like button. Okay, this will really help me a lot. And if you really like them, or if you have anything more to add, again, the comment section below is for you. So I will see you in my next video. Please take care. Bye bye.